So thank you for the question. Actually, this morning we had a planning session about what we're calling our dry run for distribution of COVID vaccine, and it's going to be utilizing drive-through points of distribution in a couple of locations where we'll use the influenza vaccine as the surrogate for a COVID vaccine, but we'll be working to set up some sites and publicizing those for November, where across the entire state of Tennessee, under a program called Fight Flu TN, that will be doing some dry run vaccination distribution. And so stay tuned for more of that. But in terms of the COVID vaccine, what was asked for by the Centers for Disease Control to the states yesterday is that the groundwork to be laid, right? And so whenever we're setting up points of distribution or making plans for how vaccine could be distributed, sites and all that sort of logistical detail, there's a long lead time sometimes to set those up, to get the permits, to identify the locations, to make sure that everybody understands where they will be, and we have all the elements in place to hold an event to do distribution of vaccination. So the instructions that we've received so far about the first doses of any candidate vaccine will really be targeting toward the essential workers that are in safety and law enforcement and healthcare settings. People who work in specific key roles will probably be the first people to be offered the vaccine. But at this point in time, there are a number of candidate vaccines that are under development, and different vaccine manufacturers are still going through their clinical trials. So at this point, we don't have a candidate vaccine. We do not have a vaccine that has demonstrated efficacy. But what the CDC is asking us to do is lay the groundwork so that we're ready for when a vaccine does become available to us, that we've already been planning on how and where that distribution would occur. And as I said, in practice for that, we're going to be co-locating flu vaccination into some of the community test site locations where people are coming to be tested, and maybe other locations that are appropriate to set up drive-through influenza vaccination, but it really has a twofold benefit. The first fold is, of course, it's a flu vaccine, and we encourage everyone to get a flu shot every year for the annual flu epidemic. And so this would be an opportunity for people to get a flu shot, and that would protect them for the flu. But it's also to test our strategies for deploying drive-through vaccination for COVID-19. Now, one thing that we do see in the proposed candidate vaccines, all the ones under trial, that they are multi-dose. And as part of the vetting of those, what that means is you vaccinate some folks, you have to wait a few weeks, then you test them and see if they've developed an immune response, and you give a second dose and wait a few weeks and test them to see if that boosted their immune response to the vaccination to show its efficacy. But with the flu shot every year, for most people right now, that's what we call a monovalent vaccine. You get it one time, but it only has to be administered a single time. But for the proposed COVID vaccines, these are two-dose vaccines that are all under development, meaning people would have to get a first shot and then come back and get a second shot after a period of time. All the vaccines that are in development will work that way.